anatomy, respiratory system, paranasal sinuses. This video wraps it all up, giving an insight into the cavities annexed to the nasal cavity. Overall, the most important paranasal sinuses are the maxillary sinus, the sphenoidal sinus, the ethmoidal sinus or ethmoidal cells, and the frontal sinus. The paranasal sinuses form during postnatal development because of a pneumatization of the facial skeleton. Near the paranasal sinuses, in addition to the main cavities, you can also find the secondary cavities. Currently, it is believed that the paranasal cavities are useful to modify the characteristics of the inhaled air, lighten the facial skeleton, and allow particular phenomena of voice resonance. The frontal sinuses are dug in the frontal bone at the level of the glabella. As we can see, their shape is triangular pyramidal with a superior apex. In the various sections, we can see that the apex almost reaches the upper frontal line, while the base is rather inclined. The anterior parietal bone corresponding to the eyebrows, and the posterior parietal bone corresponding to the region of the anterior cranial fossa. The medial wall instead is the septum that separates the two frontal sinuses. The base of the frontal sinus is divided into two regions, a lateral orbital region and an ethmoidal region, where the frontal sinuses basically complete the ethmoidal cells. The maxillary sinus, also known as antrum of Highmore, is the largest paranasal sinus of all. It is the shape of a triangular pyramid whose base is on the medial side, the apex on the lateral side. It corresponds to the front and lower vestibule of the mouth, at the top to the floor of the orbit, and laterally to the cheek, medially to the wall of the nasal cavity. Behind this head, it corresponds to the pterygopalatine fossa. The maxillary sinus can vary from subject to subject, especially its opening, which is usually in the medial nasal fossa, but it can also be found in the lower nasal fossa. There are two sphenoid sinuses that are located posteriorly at the anterior surface of the body of the ethmoid. They are about the size of a hazelnut and correspond to the vault of the nasal cavities and partly to the roof of the pharynx. The opening to the nasal cavity, as we can see, completes the vault, roughly forming a posterior wall as we saw earlier. Some of these signs have numerous variations. Their lateral surface corresponds to the petrosal sinus of the dura mater, while the medial one is the septum that divides them. The posterior wall forms the clivus of the sphenoid bone. The anterior one is almost totally absent along the communication with the nasal cavities, while the lower wall makes up the roof of the pharynx. The ethmoidal cells are a series of small cavities dug in the lateral masses of the ethmoid. They're separated thanks to very thin bone fragments. Some of them are in the ethmoid, while others are located on the bones in close proximity, like the frontal bone. They mostly open in the middle nasal meatus. Some others, however, open in the upper meatus. The structure of the nasal sinuses is very similar to the one of the nasal cavities. We can see a respiratory epithelium with a lamina propria featuring a high modulating vasculature and compound tubulo-acinar glands of mixed secretion, secreting a very fluid mucus. Finally, we can find the bony wall of these sinuses. This video was created thanks to Anatomy Learning, an interesting free web app. The hyperlink can be found in the description. Instead, the text used for the concepts is Human Anatomy of Eddie Hermes,